My name is Reva. I'm going to be your nurse today. How are you doing?
I'm doing good.
Okay. Well, I'm here. Can you tell me a little bit about what you came in for today?
A health assessment.
You came in for a health assessment. When was the last time that you had a physical?
I don't know.
You don't know the last time you went to the doctor? Okay. Well, we'll go ahead and perform that health assessment for you today. What I'm going to do is go ahead and pull the curtain for some privacy. We'll go over some basic information and I'll wash my hands and we'll start the physical. Is there a particular reason you need the physical? Are you in sports?
No.
Need it for work? Washing my hands? No? Okay. All right, before we get started here, I need your first and last name.
Cassandra.
Can you give me your last name as well, Cassandra?
Smith.
All right, Ms. Smith. And can you confirm your date of birth?
January 27, 2007.
Okay, and how old are you?
17.
And are you female at birth?
Yes.
Do you have any pronouns that you prefer? Okay. Do you know your approximate height?
No.
No? You don't know your approximate height?
No.
Okay, how about your approximate weight?
190.
You're about 190? Okay. We'll go ahead and get your height for you here in just a moment, and we'll go ahead and let you know how tall you are. And we'll verify the weight here. All right. What grade are you in?
12.
You're in the 12th grade, okay. Are you excited about graduating?
Yeah.
A little bit? Okay. All right. And you're here for your annual physical, but you're not sure when the last time you had a physical.
Yeah.
That's correct. Okay, so we're just going to ask you a few questions. Can you tell me today's date? Okay, Monday, Tuesday, Wednesday, Thursday, Friday, Saturday, or Sunday? What's today?
Monday.
It's Monday? Okay. And what school do you go to? And the President of the United States? Who's the President of the United States? You don't remember. Okay. That's okay. Nothing wrong with that. So who do you live with?
My mom.
With your mom? And how about your dad? You don't live with him? Okay. So you live with mom. Any brothers or sisters in the home?
No.
Do you feel safe at home?
Yes.
Yes. Okay. More often than not, are you missing any meals?
No.
No. So you eat all your meals for the day? Perfect. Can you tell me a little bit about your eating habits and your diet, what that looks like?
I eat all my 3 meals every day.
Okay. Any stomach issues? Any dieted?
No.
Okay. And on average, how many hours of sleep do you get a night?
8.
8 hours? Okay. Do you notice any breaks in your sleep cycles or where you're up part of the night or anything like that? Anything uncommon? Okay. Do you have any allergies to food?
No.
So no allergies. How about some medication?
No.
All right. Any allergies to like animals, like bee stings, bites? Nothing to that. Mold, pollen. Perfect. you ever smoked or do you currently smoke?
No.
So you've never tried cigarettes, never vape,
Nope.
anything to that nature, okay? Does anyone in your home smoke?
Nope.
Okay. Great. So this next question's a little difficult to answer for some of our younger ones. Just to be perfectly honest, this is a safe space, and I can't go back and tell your parents what we discussed in this room, okay? Have you tried any illicit drugs?
No.
So no marijuana, no illicit street drugs. Okay. How would you describe your social support system?
Fairly good.
So you have friends, you have people who you can call if there's a crisis or an emergency. Okay. And who would be your first person to call if there was an emergency?
My mom.
Your mom? Okay. Is there any drug use in the home?
No.
No? Okay. How about any alcohol use?
No.
Okay. With yourself or your home? With anyone inside your home?
No, myself.
Does your mom drink or anyone else in the home drink alcohol?
Occasionally.
Occasionally? Can you describe occasionally for me?
Not often at all.
You say one time a week, one time a month,
Closer to once a month.
once a month. Okay. Perfect. I'm going to ask you some history for your family. If you don't know, that's okay. So when I say your maternal grandmother, that's your mom's grandmother. And when I say paternal grandfather, grandmother, that's your father's side. Okay, so that's your paternal. Great. Do you know any health conditions that your mom has? Whether that be high blood pressure, history of cancers, anything abnormal?
No.
No? Alright. How about your father?
I don't know.
You don't know dad's history?
No.
Do you know if mom would know that?
I don't know.
Is mom here with you today?
No.
Okay. If at all possible, if it becomes pertinent, we'd be able to reach out to mom to get some of that information.
Yeah.
Okay. Alright. Your mom's mom, has she has any medical conditions? That'd be anything that you know of. Heart conditions.
Cancer.
She has cancer. Grandmother. Do you know what kind of cancer?
No.
Unknown. Any other issues that you're aware of?
No.
Alright, and how about your mom's dad? Your grandfather?
I don't know.
You don't know? Okay. And then do you know anything about your father's mom and dad, so your grandparents on your dad's side?
Grandpa got cancer a few times.
So your dad's grandpa got cancer a few times?
My grandpa got cancer a few times.
Okay. Cancer, and then how about grandma on your dad's side?
I don't know.
You don't know? Okay, that's fine. Like I said, we'll try to buffer in some of those gaps. Okay. Can we talk a little bit about your menstrual cycle? Have you started your menstrual cycle?
Yeah.
Yes. Are they fairly regular, whether they're every 28 days, 30 days? Do you know how many days?
No. I don't know how many.
You don't keep track through an app? There are apps out there that you can use to track your period and give you a good estimate of when your period should start and then maybe some symptoms. Do you know the date of your last period?
No.
Approximately
About a week ago.
a week ago. And how does your menstrual cycle with you? Is it just a few days, 7 days, 5 days? How long does your menstrual cycle last?
5 to 7.
5 to 7 days? And how is your bleeding during that time?
Maybe.
Heavy? Okay. And would you say that you are soaking more than one? How many tampons and or pads do you soak in a day's time that you would use?
3 or 4.
And then are those tampons or pads? Pads. And what kind of pads are they? Are they overnights, regular pads?
Regular.
Regular pads. And how many again? 8?
I said about 4.
About 4 in a day?
Yeah, during the day.
So for a full 24-hour period, how long? Or how many?
Probably about 8,
8, okay. 8 pads, and then the regular pads. Okay. How about any discomfort? Are you having any discomfort during your menstrual cycles?
yeah. Strong cramps.
Strong cramps. And what do you do when you have those strong cramps?
Take medicine.
Okay, what kind of medicine?
Ibuprofen.
Do you know the milligrams of that?
No.
Okay. And it's just regular over-the-counter ibuprofen? Okay. And then, so you don't know the milligrams. Do you know how many you take in how many hour intervals?
I take about 4 at a time, but I don't take them often. I only take about 4 a day
4 a day
at the same time.
at the same time. Okay. Great. And on a scale of 1 to 10, during those menstrual cycles, how would you rate your pain?
Typically an 8 or 9.
8 or 9? And that's 10 being the worst pain that you have, it's 8 or 9? Okay. Okay. Have you been diagnosed with anything as far as fibroids or cysts or anything like that? No diagnosis? Okay. And when was the last appointment you had with your gynecologist? Or do you not have one? Okay. Have you ever been pregnant or possibly could be pregnant?
No.
Okay. And are you sexually active?
No.
No. And are you taking anything now to prevent pregnancy? Any kind of medication? Okay. Is that something that you're looking to get on? Is some kind of birth control?
Yes.
Okay. And out of all the birth controls that are out there, there's a lot out there. Are you familiar with any of them?
Not really.
Not really. So they have like a pill, they have a depot shots, they have all different kinds of things. We have our providers and we can go over those options a little bit later for you. And if it's something that the provider feels comfortable with offering for you in this visit, we can offer you short birth control, okay? All right. Give me just a minute. I'm gonna look through, make sure a long thing, so I just wanna make sure I've got any things. Do you have any major stressors or any major events that have happened to you in the last few months that's causing you distress? No? Are you up to date with your immunizations? You don't know? Okay. So you don't know if you've had all your shots?
Yeah.
Okay. Would mom know this?
Yeah.
Okay, we can try to look it up, and if not, we'll get mom to fill this in. Do you know if you've gotten the flu vaccination in the last year?
I don't think so.
No flu, and how about COVID vaccinations? Did you get those?
A long time ago. Yeah.
Okay. Did you get both sets of the series? There was
No.
2 shots, just one?
Yeah.
Do you know what provider you got that from, or what manufacturer, whether that was? No? Okay, that's fine. We don't have to do that. Alright. So I'm gonna go, I've got a little bit about health histories and a little bit about you. Screen time. How much screen time do you normally have?
I'd say within a day, probably 6 hours.
6 hours? Okay. And exercise. How many times a week do you vigorously exercise? And for how long?
I go to the gym for about an hour.
An hour? Okay.
A day each week.
hour a day each week. So you do it 5 days during the week or the full
5
7?
days.
5 days a week? Hour a day, 5 days a week. Okay. Are you all taking any medications? I know you're taking Advil with cramps over the counter. Any other times that you take Advil?
For migraines.
Migraines. Okay, hold on 1 second. And what does the dosing look like for your migraines? How often do you get them?
I don't get interrupting anymore, but I only take 2 for my migraines.
You take 2 of the Advils, and this is the over-the-counter one. Okay. And you said you don't get them very often. How many times is often? Is it a couple times a week, a couple times a month, a couple times every few months,
About a couple times a month.
a couple times a month? And when you get these migraines, how does your day-to-day look when you have a migraine? Are you able to function and do everything?
No, I typically stay in my bed in the dark.
Stay in bed. Dark. Can you describe the pain that you're feeling and where the pain is located?
My eyes and like this part of my head.
On the top of your head. And you're saying like behind your eyes or just your eyes?
Behind my eyes.
Behind it?
Like a throbbing pain. Right
And it's
here.
throbbing. And when you're having that pain on a scale of 1 to 10, 10 being the worst pain you've ever felt, where does that feel like for you when you're having those migraines?
About a 7.
About a 7. Do you have any family history of migraines? Anybody else in your family suffer from migraines?
I don't know. I don't think so.
No. Is there anything that happens before you get a migraine? So anything that you know that triggers those migraines?
Not that I know of, no.
No triggers. Other than the Advil, is there anything that makes them better? Anything that makes those headaches better?
Staying in like the dark.
Dark
Taking a
room.
nap.
And sleep. Okay. Alright. So you talked about migraines. Is there anything else that you have a concern about with inside your body that you would like us to know or look at?
No.
No? Okay. Any open wounds? Anything like that?
No.
No. No open wounds, rashes?
No.
Okay. Have you fallen or hit your head recently?
No.
No falls? And you said you don't play sports at this time, so no
No.
contact sports or anything like that? All right. I'm going to go ahead and take a minute to go ahead and get your vitals here, and then we are going to go ahead and start with a full assessment. So I'm going to take a look at your head. We're going to palpate your head, which means I'm going to touch over and feel. I'm going to look at your, your eyes, your nose, your throat, your ears. We're going to go through your vital systems here. The other question I had real quick before we get started was bowel movements. Are you having regular bowel movements? And how often do you say that you were having those?
About once a day.
Once a day? Okay. And have you ever been hospitalized?
No.
Okay. Are you being treated by any specialist?
No.
Mental health practitioner?
No.
Okay. All right, let's go ahead and get started here. I'm going to go ahead and get a set of vitals and height and weight. So if you come over here, we'll go ahead and get your height and weight and set of vitals. All right. So you are 5'4". All right, and I'm just going to have you walk for me. And while we're up, we're going to go ahead and do a few things while we're up. Okay. I'm just going to have you walk from here to the door and back for me. And if you'll just face the wall for me, I'm gonna have you bend over and I just wanna look at your back. So if you just curve your back for me. And I'm just gonna touch from base down, okay? Any pain as I do that?
No.
Nope. All right, go ahead and have a seat back on the chair for me. All right, so I've got your vital signs, all within normal range. So really good there. Let's go ahead and take a look at your hair and scalp. Any hair issues, growth, anywhere? I'm gonna go ahead and touch your head. I'm looking for lumps, bumps. Okay, any pain while I do that? Okay, can you look up for me? Look down for me. Look side, side. Any pain?
No.
Okay, I'm gonna have you follow my finger. Alright, perfect. I'm gonna shine this light into your eye. Perfect. Eye. Perfect. Alright, can you have you open up your mouth for me nice and wide? And can you stick out your tongue? Okay. Do you have any dental issues? Any cracked teeth or anything like that? Okay. I'm gonna go ahead and feel. Okay. There. I am just checking all of your pulses, okay? All right. Can you reach out and grab my hands for me? And I want you to squeeze as hard as you possibly can. Nice and strong. Good. So I'm going to have you hold your hands out straight like this. I'm going to push down on your hands, and I want you to hold me up, okay? Perfect. Same thing, I'm gonna have you, and I want you let me not move your hands up, okay? Ready? Perfect. Okay. So I'm gonna go ahead and take a listen here. So I am going to position this, and I won't do this, we're gonna keep you clothed on camera, so you can have your shirt off. I'm gonna listen to your heart sounds and your chest. As I tell you, I'm gonna have you just breathe nice and deep for me and just normally, okay? Nice and in, nice and slow so I can hear what's going on in here. Do you experience any shortness of breath? Alright, no shortness of breath? Okay, I'm just gonna go up under. I do apologize. Perfect. I'm gonna listen on the back side now, okay? Nice and tall for me. Alright, can you cough? And again? Perfect. Alright. I'm gonna have you put your knees forward for me as nope, just like ankle them for me. Perfect. Perfect. Alright, I'm going to check for vital pulses. Any pain or tenderness? No? Okay. Alright. I'm going to have you push your feet up at me. You're going to try to push me away from you. And then we're going to do it where you pull me into you. So, perfect. Now I'm going to try to lift your legs up. I want you to hold. Good job. All right. I'm going to take a moment to go ahead and look into your ear. Do you have any hearing issues?
No.
Anything to that nature? No? this pretty much goes over our entire full assessment here. So what I'm gonna do is put the notes in for the physician. The physician will come in and see you before you go. Do you have any questions about what we did today or anything that I can do for you?
No.
No? Okay, so I will let the provider know that there's an opportunity for you to go on birth control should you like to go ahead and do that in our office today. And they'll go over those options with you at that time, okay? All right. Do you need a printed out physical for school?
No.
No? Okay. Now, the last question I have for you before I go ahead and put everything in, should we need to put anything into the pharmacy? What is your local pharmacy? Which one do you use?
CVS.
CVS? Okay. All right, and they can handle your next appointment and anything else at the front desk when you go out, okay? All right, I am going to wash my hands. Again, my name is Retha, and it has been a pleasure taking care of you. I'm gonna go ahead and let you get settled here. Like I said, the provider will be in, and then we'll get you dressed and out the door, okay?